While studies show that Americans are living longer, they may not be living healthier, and the growing gap between lifespan and health presents some long-term issues. The CABS Social Care Network strives to address home care and social service needs in underserved communities in New York City and Long Island. Here today to tell us more is CABS Health Network CEO Sherly Demosthenes-Atkinson. I was so focused on mispronouncing your name correctly.
Right.
Demosthenes.
Right.
All right.
Got it.
Thank you for sitting down with us today. CABS has been around for quite some time, right?
Yes, it has been around since 1979. Based in Brooklyn, but it serviced the 5 boroughs, including Nassau County. So underserved communities have always been our focus, to ensure that individuals not only have the home care services that they need, but also trying to figure out how to wrap other social needs for individuals that we're already servicing, but also neighbors who are not part of our services. Yes, so we have been able to outreach as many individuals as possible. Now through the Social Care Network, we're able to do that.
And why do you think, I think especially at this moment in time, that is such an important addition to your arsenal?
Well, we always seem to find individuals who wouldn't have access to certain type of services if they either are not receiving the right information or having the right set of services within their communities, because information is key to individuals searching and finding what they need. And CABS always try to find what the community needs and determine how to best service them. And now with the Social Care Network, it is the focus to improve health outcome.
And essentially what you're saying is that yeah, these social factors are part of of overall health.
Correct. Of course, social needs are not just home care. It is housing, it is nutrition, and it also transportation. What we did discover, and so was New York State, because the focus is to try to connect individuals to services, but particularly I think the Social Care Network under the Medicaid 1115 waiver is to more so have a focus on Medicaid individuals, because those are the individuals who are at most need to have health-related social service needs. And that includes what I just mentioned, which are housing, nutrition, and transportation, to help them actually live healthier lives, and also help them improve health outcomes. And that's always the goal for us.
And how have people responded to, because really you broadened the work that you're doing. How have people responded to that? And are that, because in the past, talking to folks that offer the kind of help, sometimes people can be reluctant to let you know what they need, almost as if they're embarrassed, even though the need is there through no fault of their own.
Correct. And I don't think health care should be something to be chased after. What we try to do is to bring health and health services to the community. So for individuals who may not be necessarily be heard about what they really need, CABS create community innovation hubs where we utilize spaces in communities that would not be necessarily be considered as communication hubs to discuss the needs of the community. So we find ways to allow for the community to be heard, to discuss their needs, and tailor those needs to make sure that we address all of the health-related social needs, not just if it's home care or care management, but care management also provides some level of mental health services but the social care network now, it's formally funded to address those needs.
How are you just said it, that it's formally funded, because I was going to ask, how do you have the resources?
We didn't have the resources before. We were providing those services just as part of what we do in case management. But with the social care network, creating a system of social care network providers, because CABS is a contracted provider under 3 leads: Public Health Solutions, SOMOS, and also the Staten Island PPS.
You know, there's a lot of talk, cuts to Medicaid, concerns about how that might impact your ability to provide some of the services that you do now?
Of course, because we depend on rate reimbursements, and if Medicaid funding is cut, that also will affect how individuals are qualified to receive certain type of services, especially with this, again, going back to the social care network, because it is so key in linking the additional services to individuals, not only the ones that we're already servicing, which are seniors and the disabled, but also the neighbors who would need that kind of service would not normally receive it. With the Medicaid funding cuts, this year may not be the year that they all feel it or we all feel it, but in the coming years we will see the impact of the Medicaid cuts.
And have you been in a position of trying to prepare for that, or?
As a not-for-profit,
Yeah, it's hard.
it's very hard. And we rely on one activity that we do every year is the Circle of Care Awards, which
that's
is
coming up in October.
Yes, in October. And we're looking forward to kind of do some level of fundraise and bring recognition to not only our partners, but our home care workers who actually support the work that we do. And as a matter of fact, this year we're actually honoring breast cancer survivors who are also part of the Silver Age group. And they're still working, providing the care that individuals in need require. So we're excited about that.
You guys are like the little engine that could. I'm going to send people to your website, cabshealthnetwork.org.
Correct.
And your Circle of Care Awards is scheduled for October 16th.
Yes.
Correct?
Yes.
And again, you honoring partners and individuals dedicated to what your mission is.
Correct.
And it's even more important now.
Yes.
So, and can people use, I know it's a fundraiser, so if somebody wants to have tickets or whatever, if they go to your website, they'll be able to find out information.
Absolutely.
All right.
Absolutely.
Thank you so much
You're
for sitting
welcome.
down with us
It was a
afternoon.
pleasure.
And look, there's so many people that without their services, they would not have the care they need. So you are
Absolutely.
doing really God's work.
Thank you.
Thank you very much.
You're welcome.
We'll be right back.